the term provider collaboratives is one that is causing a bit of mystery out there as to what they are and how they look. You just touched on the fact that you've had one up and running for a little while now. How does it look and what does it do? If you could sort of briefly summarise, I'm sure there's lots that you are.
So its construct is it's all of the acute providers, so Ambulance Trust, Mental Health Trust, and the acute hospital trusts. The things that we focus on are where we can do things well and once. So a good example of that would be we came together to talk about breast services and how disparate the breast services were across our patch. We all agreed they were disparate. We collectively said what would good look like, and whilst that meant some give and get from organisations that provided those services, keeping the patient at the forefront of that, we actually very rapidly just agreed to change. So that's one great example of what a collaborative will do. We have all joined together through that collaborative to think through the elective recovery programme. So that included ourselves as ambulance provider and the mental health trust. So it could very easily simply have focused on the acutes and what their recovery needed to look like, but we've had a much greater rounded view. We're able to commission pieces of work through our broad teams, particularly through our excellent network of chief operating officers, who, you know, as I say this tongue in cheek because I was a chief operating officer for a very long time. The chief operating officers, they're the people who run the show on our behalf as chief execs. They are a very, very valuable asset and a very strong team. So, you know, that ability just to come together to fix some things that actually have been on the stocks for a long time. And then now we are focused on the forward view and what that might look like, including things like, you know, what does the sustainability agenda look like? How do we get to net zero on our carbon footprints? All of those big, important things that actually we would do better together than we will as individual organisations.
And that decision-making process in terms of how that goes, who brings things to that forum and how is that decision made about what to pursue?
Yeah, so we can all, anybody can bring things to the forum, and it, you know, to date, because we've only been really formed since September, to date we have really focused on urgent priorities that have focused in on COVID, Tom, is the honest reality at this moment in time. But the interface between the ICS and the provider collaborative will be a really great one going forward, because they will, in our thinking, be tasked with the delivery of the strategy that the integrated care system alights on. So we will be the work programme for that.